sleep, so you're in this, you're feeling even worse. Um, but of course, if pain is the main reason you can't sleep, then you have to get a pain medicine for that. And that's the other thing. But again, you have to look at it whether it's the pain that's keeping you awake or whether it's the fight and flight mode that you're in. And it could be both. So first take care of the pain and then start working on the flight and fight mode. This is the question I get asked a lot about. By the way, on the sleep, the clonidine is a drug worth trying. It's worth trying for sleep. It might be, you may have to increase the dose, may have to put in a. It's important to get a home sleep EEG monitor to see what. There's a company called General Sleep, something General Sleep. If you Google the words General and Sleep, you'll find it. They can print you out this device and you can try it for a month or two. Vaccination and CRPS. Vaccinations, remember something, you don't want, your body is already inflamed. You don't want anything to increase this inflammation. So, if you get pneumonia or if you get flu or if you get some kind of a disease because you didn't get the vaccine, it's going to make the CRPS a whole lot worse. So my reasoning on that is to get vaccinated. You don't want, if you don't get your flu vaccine and if you get the flu, your CRPS is going to be out of control. So it's important to get vaccinated. The question is, what kind of a needle? Use the thinnest possible needle. You don't want to use a thick needle and all that. But it's really important to get vaccinated.
What about how the flu comes in a mist?
Fine, whichever, that's even better. But either way,
that's more of a live virus, isn't it?
Yeah, but it won't. It's live attenuated virus, so it won't cause inflammation. I don't know where it came again. Needle stick trauma. We talked about this. You have to avoid needle sticks as much as possible. If you need a blood test, make sure that all your doctors get together and have one stick done. Use the thinnest needle possible. Just as you walk into the place, you tell the phlebotomist, I have difficult veins. I need the person who's the most experienced in drawing blood. That's really important. Even if you don't have difficult veins, it should be one stick, preferably no stick, but if it has to be a stick, then one stick. Because any trauma to you can set off your RSD. Those who are undergoing regular infusions like ketamine or hydration therapy for POTS should think about a chest coat. PICC line is a bad idea. It's a bad idea. Because that sticks out of your body. It's a portal for infection. There's a portal of constant pain and infection and all sorts of nasty things. PICC line is a bad idea. Therapies of questionable value. Okay, there are lots of them. Opioids, everybody's talked about opioids. I won't waste time on that. But just so you know that they're counterproductive. There's been no long-term studies, and we know exactly how opioids make CRPS work. Hyperbaric oxygen. I've heard a couple of people have had some response from it, but nothing long-lasting. Nothing that. The only study, there have been only a couple of reports. They're all anecdotal, mostly published by people who own hyperbaric centers. It's not. And my argument is, there's no harm in trying it if you can get access to it, but please don't spend a ton of money to get a hyperbaric chamber and try it. There's really no value to it. Definitely no science behind it. Sympathetic nerve blocks, please don't do that, not at all. There's no data to show that they work. There are only, there are only maybe like 3 people in the entire universe who responded to them. But they do stereo ganglion blocks for upper extremities, lumbar sympathetic blocks for lower extremities. They have neither a diagnostic or a therapeutic value. At best, it will work for a day or two. You can use them if you're doing a continuous, I think you can put it, some people try putting a continuous catheter and continuously infuse. That's another thing. That's a whole different story. Can be done. But studies on doing single shots of stereo ganglion blocks or lumbar sympathetic blocks have shown them to be inconclusive. Spinal cord stimulators is a no-no, absolutely. Just the the risk of putting that thing in there is the surgical complications from this is 50%. 25 to 50% develop surgical complications. Now, these surgical complications are not getting a little abscess here, it's in your spine. Okay, so the leads break, the leads get dislodged, they get infected, all sorts of nasty things happen. But what's more important is, studies have shown that at 3 years after implantation, it's the same as not having a spinal cord stimulator in there. Keith will tell you, he's had 5 of them?
9.
9.
And the last ones I got staph and almost died.
Yeah. And I think the hospital made a $1.2 million. How much did he say?
1.1 is what it was.
$1.1 million.
Because they're 100 and some thousand a piece, then they put them in, then they take them right back out, then they throw them away because they got staph. So it was a long, then PICC line, then antibiotics over a period of months. So no, it wasn't fun.
So there's really no data to show. Anything that you hear or read about is temporary stuff they get. Some relief, yeah, maybe just, you did get some relief from it.
Yeah, you get some relief.
Some, but it's not worth the risk of doing it. The risks are very high. So, postural orthostatic tachycardia syndrome, POTS, also falls under the umbrella of what is called dysautonomia. Dysautonomia is, we see this a lot now, we see this in CRPS a lot. Again, is it CRPS, is it mast cell activation disorder that's doing it, or is it a whole different animal? We don't know. Patients usually present with dizziness and a racing heart, usually when they change position, when they stand up. The definition is if the heart increases by 30 beats per minute, or if it goes to 120 beats per minute, and if you have kind of dizziness, you don't get dizzy, but sort of dizziness, then it's called POTS. The treatment is, there are lots of treatments, but you have to increase your salt intake. Not just food salt, but actual salt pills. I have one 18-year-old, she takes 18 grams of salt a day. So, salt. Fluids, girl drink a lot of electrolyte water, lots, constantly. Compression stockings up to your waist. That's a hard one, because if you have RSD in the legs, then it's kind of tough. But compression stockings up to the waist. And then there are a whole slew of medicines that can be taken. The diagnosis for this is done, there are 2 ways to diagnose it. One is, you can do, the simplest test to do is called orthostatics. You go to the doctor's office, they check your blood pressure and your heart rate while you're lying down, and then they have you stand up, and then they do it again, and then they'll see the difference. If it increases by 30 beats per minute, or if your heart rate goes up to 120, then you probably have it. The brutal way of doing this is to do what is called a tilt table test. And the tilt table test is pretty brutal. They strap you to a table, and then they hook you up to the blood pressure and the pulse thing, and then they tilt the table. If you have POTS, it's brutal if you have POTS. Again,
you can feel it in your fingertips. You can feel your heartbeat in your fingertips real hard too.
So most physicians will try to do it in the office, just have you lie down, stand up. But a cardiologist, if you can ask for a tilt table test, then that should show you if you have it. The treatment again is not that hard: salt, fluids, and compression stockings. CRPS in children. Children do develop RSD. The good news is that about 93% of these children will respond to treatment. They get actually better with proper treatment. They do have some relapses, but the relapses come and go. Of course, it's the same thing. It's more common in girls. The problem with children. Are there any parents over here? Lots of them. So the problem with children having it is that they're labeled as being behavioral, conversion disorder, and something stupid called Munchausen syndrome. Does anyone know how many cases of Munchausen syndrome? You've been diagnosed with that?
Well, they tried to diagnose it.
Do you know how many cases of Munchausen syndrome are there in the world since the history of time? 1. So maybe you're the one.
She didn't have it.
We keep getting-
They tried to diagnose of that, and they
I know.
couldn't figure out what's wrong.
Yeah, being physician, it's like these people, physicians tend to diagnose Munchausen and the conversion disorder. You know how difficult it is to diagnose someone with conversion disorder? You have to follow, the same group of physicians have to follow the same person for years before you can say conversion disorder. Not walking into somebody's room and saying it. Nancy?
They're also not just children, but also adults.
Yes.
Yeah.
It's also in adults, that's true. So it's very difficult to, these diagnoses are really challenging. It's much more difficult to make these diagnoses than to diagnose RSD. And these are more rare than RSD. But we physicians are very good at diagnosing this in 2 seconds. So I just said the same thing. It's really hard to diagnose these patients have to be followed for years before you can say that, and you have to literally rule out every known condition before you can say that. Now, children with RSD. So children with RSD, one of the things that we've noticed is that I was seeing all these kids with RSD, and we were a little confused. Why were kids developing them? And it turns out that a lot of them have what is called Ehlers-Danlos syndrome, or EDS. I think we have a bunch of them here in the room. Jessica's going to show us.
You have to show me.
So, in a minute, let me just
Okay.
let me explain to people what it is. EDS is a defect in the connective tissue. So the human skeleton is connected by tissue. Okay, otherwise I'm just a bag of bones. And that's called connective tissue, obviously. And the connective tissue connects different parts of the body. It connects the bones. It forms the joints. It's also in the muscles, the nerves, the ligaments, everything. It's in my skin. It's in my intestines. Every single tissue of the human body, there is connective tissue. Oftentimes they present as loose, double jointed or loose joints. They dislocate or subluxate joints easily. The skin is very hyperelastic. It's an inherited condition. We're not sure why these people develop CRTS. Jessica is going to show us some of the testing for it.
I just got diagnosed by Dr. Chopra at
That guy, I know.
Yeah, I know.
Heard of him.
At the RSDSA conference in Fort Lauderdale. If you can things like this.
She can touch her forearm, and mom can do it.
Jacqueline, show your other one.
My arm?
Yeah, your arm. It's probably better. This is what you can do with your arm.
So this is one of the tests. So if you can touch the
you
forearm.
can do things like that, or like kind of twist your arm all around.
Yeah, she's twisting it a whole 360
Or
degrees.
just kind of, or kind of do things like
Can you bring your arm around
like
your...
this.
Jacqueline, bring her on.
Jacqueline, can you bring your arm around your belly? Can
My
you
belly.
No,
Which way? Like that?
face the audience.
I can do whatever you
Can
want.
you...
Whatever you want. You can do whatever you want
So
with
she
my
can
left
almost-
arm. Oh, whatever you want. I could do whatever.
So she can almost bring it to her belly button.
This?
This is her belly
Absolutely.
button. Yeah.
I can bring my leg over my head. I can bend. It's like my right hand. I can't anymore, but it's kind of ridiculous.
Yeah, we
You're
we all-
your
It's like a
ligaments are
party.
very stretchy.
Yeah, and
everything.
you wake up and
The
you have bruises
bruising.
and you have no idea why.
That's why.
It's
That's
EDS.
why. Do it again. Yeah.
Do it again.
Wait, which
So,
one? The left hand.
So the reason I'm bringing this up is... So the reason I'm bringing this up is because it's not just children. They are...
I never knew.
We have grown up.
September.
These kids, they had EDS all their life, and now they've grown up to be adults, and they still have it. The question is, why would these patients with EDS, with a defect in their connective tissue, have this condition? That's Jacqueline's mom, she's responsible for it.
And my
Jesse
know
does
my dad.
that.
my
And
little
Jesse does that.
7-year-old niece has it.
Jessica's dad has it.
No,
So-
Yeah.
Now, how do you test for it? The testing is really simple. There is something that
And you can see my veins. I'm very fair.
I didn't put it over here, but it's called the Beighton score. Beighton, Beighton score. It's a bunch of tests. You can do it by yourself. If you Google it, there are pictures on it. And it'll show you. I can show you real quick. One is if you can touch your forearm, your thumb to your forearm. That's 1. The other side is 2. Your pinky can go all the way back, more than 90 degrees. Jessica, let me see.
I think this
So
one.
she can. So this is 1. She can almost touch it there. The pinky. Can you show me the pinky? So the pinky can go all the way there. That's 2.
Jessica, so does Daddy.
And
she's
yeah, so
worse
is
than-
Daddy's.
It's mine?
Oh, now you're all just showing off.
Oh yeah, you too.
Yeah, right.
Yeah.
You
So
could actually bend. You could probably bend down and go through your legs.
so 1 on each side. That's 1 and that's 4. Okay. 5 is if you can extend your elbow and it kind of goes out, like hers is doing that. So it's hyperextending her elbow. So 5, and then the other side is 6, and the other 2 are your knees. If you can hyperextend your knees, that's 7 and 8, and 9 is if you can touch the floor with your flat of your hand.
So this is like an extortionist.
So she's
Yeah,
kind of-
that's it.
Contortionist.
So if you can bend down and touch the
I never said I could
floor-
speak well.
He's got some pills he's on.
Cool.
By the way, those of you who don't know Jessica, she had RSD, now she doesn't. Because she had ketamine, right? When was that?
They'll hear it in
July
July
of
30th.
2012.
July 30th.
She lost her
2012.
diagnosis. But this is what I'm trying to point out is that you can, if you have EDS, and this, what I just did was a Beighton scoring system. In most cases, if you have any score above 5 to 6, it's considered pretty positive for it. If you Google it, you should see the testing. That's a sort of gives it, hers is pretty much 9 or a 9. But the question is that we're now struggling with is that connective tissue. What has that got to do with nerves? We know it's got to do something with the joints, the muscles, but what has it got to do with the nerves? And we don't really have a great answer. But we do see a lot of symptoms of autoimmune disorder in these patients. And we've talked about autoimmune conditions, how CRPS is an autoimmune condition. We talked about that. And these patients present with pretty much the same symptoms of autoimmune disorders. They present with symptoms of RSD, like Jessica did, Jacqueline does, nerve pain. And so the question is, we have to focus on treating EDS. Right now, if you went to most physicians would consider it to be an extremely rare condition. The incidence of EDS in the United States is 1%. That's very conservatively speaking is 1%. There are 4 types of EDS. The 3 of them are okay if you have them, it's not bad. There is one type called the vascular type, which affects the blood vessels. That is considered to be the more risky one, the dangerous one. And that's, if you suspect you have that, then get it tested. There is genetic testing is only positive for the vascular type. The others, there's no genetic testing for it also.
Does Marfan's fall into that?
Yes, Marfan's falls into it, absolutely. Marfan's, those of you who don't know Marfan's is, these are mostly very, very tall people. They have a huge wingspan. And
They use Abraham Lincoln as a
kind of, yes,
model.
You might have had one, yes.
that everybody knows what he looks
But
like.
but it also affects the connective tissues of your heart, so you should always get an echocardiogram to make sure you don't have mitral valve prolapse or something like that. But that's important to think of is EDS, because EDS patients also present with POTS, very, very, very common POTS, or dysautonomia as we call them. And again, it's because they have their veins just distend a lot, so they can kind of get dizzy a lot. Very unstable joints, and so that's pretty much about EDS. this is a book that these are resources I want to bring up. You all know Nancy. Nancy spent a lot of time writing this book. And it's...
Come on. Stand up. Come on. You could stand up.
It's a